and they will be empowered. They will feel good about their mouth health, and then there will not be this fear. And if you have a dentist that's not empathetic, it can become even worse because they're telling you to stop doing this or open your mouth. And for you, it's too difficult and it's too traumatic. And hopefully no longer the awful thing that was the gift of dentures. It was a wedding gift. Are you afraid of going to the dentist? Do you get stressed before a dental appointment? You're really not alone. There are a number of people who are terrified of going to the dentist, and they would do anything to avoid having the need to go. And as a child, I had a terrifying experience going to the dentist. Not for me particularly, but for my brother, who had really bad teeth. He was a big cookie fan. And I remember him being tied in the chair and the noise of the drill and the sound and the smells. I remember hating even sitting in the waiting room, where in the waiting room of my dental office, there was a big old grandfather clock ticking every second of the agony that we had to wait to be called in for the dental treatment. And back then, parents were not allowed to go in the operatory with the child. It was an awful, terrifying experience. And it's no wonder if you've had the experience like that of something unpleasant as a child, maybe having a lot of cavities filled and they were painful and uncomfortable, maybe having toothache, maybe having extractions. None of that is pleasant. And it can taint your entire life experience of dentistry. You can get so paranoid that when you sit in the dental chair, you really can't breathe. You really can't swallow. You can't open your mouth, perhaps. And if you have a dentist that's not empathetic, it can become even worse because they're telling you to stop doing this or open your mouth. And for you, it's too difficult and it's too traumatic. So I worked for many, many years with phobic patients, trying to help them, children and adults, when I worked in Eastbourne in Sussex in England in the 1970s. And on Saturday mornings, I would open my office to educate patients, to teach them, to have children come and just look around and try the chair. And maybe we had a story. We made it an experience where the smells of the dental office weren't necessarily associated with the things they didn't like, but with things they did enjoy. I made a waiting room that was always full of exciting animals and pictures and climbing things and coloring books and to make it as much fun for children as possible. And that's where, I believe that if we begin with pregnant women and with children, educating and helping them to have a better time with their teeth and their oral health, we can develop a new generation that doesn't fear the dentist, that doesn't need to fear the dentist because they have beautiful, healthy teeth. And again, my story is very personal. When I went to England, it was one of the second or third jobs as I had in dentistry. I worked for the school service in the United Kingdom. And I was taking over the place of a dentist who had to give up quite quickly because his eyesight was deteriorating. And he had made a treatment plan for that day for the patients I was going to see. And I write about this in my book, Kiss Your Dentist Goodbye, because it was a turning point in my career. I knew how wonderful teeth could be. I had seen that in my previous office experience. I had realized during my training how bad teeth could become. And then I was experiencing this critical moment of being a school dentist, a children's dentist in England in the 1970s. And when I took a look outside the operatory door, there was a line of children sitting on a bench next to their parents, all parents and children, nervous with white faces, not saying anything. There was almost complete silence because children had to behave. They were seen and not heard in those days. And these poor children came in, and my only job that day was to extract teeth. They were given nitrous oxide, the laughing gas, and then I went in to extract 1, 2, sometimes all these children's teeth. And it was so traumatic for me to see this devastation of young children's mouths. I had no idea, and you may have no idea how awful so many small children's mouths are, how much disease there is in the world. It's called early childhood caries, and it is completely preventable. It is, say it again, completely preventable. This is tooth decay before the age of 4. This is tooth decay so bad in baby teeth that children are rendered without teeth because all the baby teeth are so decayed. Now, they don't grow like that. They are infected like that. And most often the infection comes from the caretaker, somebody who is looking after these children who has tooth decay, and the bacteria will spread. They will share the bacteria in the droplets of saliva when they kiss, hug, cuddle, chat, talk, anything. You can't avoid sharing within a family group. Don't try and save the silverware or don't kiss your baby. You are going to share bacteria. My plea to mothers and parents is share good bacteria. It's not difficult to change the kind of bacteria in your mouth. And this is why I call xylitol a gift. I actually believe the gift of healthy teeth lies in understanding how to use the equivalent of 1 teaspoon of xylitol a day in the correct way to change the oral health of adults in 6 months. And you do that with a tiny amount 5 times a day, 1/5 of a teaspoon, or if you want to eat it as a commercially made mint or in a piece of chewing gum. But 5 exposures to a small amount of xylitol every day will get rid of plaque bacteria and promote the healthy mouth bacteria that you do want to share with your children, because they are going to have bacteria in their mouths. There is no mouth without bacteria. That is not possible. So let's make sure our children have healthy bacteria in their mouths, and then they won't have plaque. And if they don't have plaque, they won't have cavities. So they did studies back in the 1970s where they gave xylitol gum, a small amount, 0.7 of a gram, 7 times a day, so that they actually had 7 grams, which is a little over a teaspoon a day, to pregnant women. And they measured the plaque levels in these women's mouths, and they were at 100% at the beginning. Their mouths were bad. But over the months of using xylitol in the correct way, these mothers ended up without plaque in their mouths at the time after their babies had been born, and the babies were beginning to erupt their new baby teeth. So these mothers are hugging and kissing and cuddling with their little babies as the new teeth erupt. And you see, plaque bacteria can only multiply on a hard, non-shedding tooth surface. Plaque bacteria don't multiply in your saliva. You've never seen lumps of plaque in your saliva. They need a hard, non-shedding surface on which to grow. So what these mothers had done was, in essence, change their plaque levels in their saliva. Even if they still had cavities, even if their teeth were still bad, their saliva was clean. And when they kissed their babies, they kissed healthy bacteria to the babies. And it was the healthy bacteria that colonized, that took over and occupied the space on these new baby teeth. And as the baby teeth grew in the second year of life, the baby teeth that grow in the second year have grooves in the molar surfaces. And if your baby has healthy bacteria, those healthy bacteria will go in and get a foothold in the baby teeth, in the surfaces of those molars, the baby molars. And this is the most wonderful way to ensure that that baby mouth is going to stay healthy. In fact, in Finland, they have a public health program that has been in place now for over 65 years, where they give xylitol, little mini pieces of gum, to the children going to preschool in Finland as they arrive at school, after lunch, and before they go home. Now, they're assuming they may have another couple of exposures to xylitol at other times, maybe in the morning before school and maybe as they get home or before bed, before sleeping at night. But xylitol in this small exposure amount in preschool years builds on that same idea that they want to keep the whole mouth biome healthy, eliminating plaque and keeping healthy bacteria fed and nurtured by the xylitol. There are studies, if you want to look at the University of Turku, Turku in Finland, they have done so many studies on xylitol. They have actually developed artificial mouths with saliva and teeth to show that not only can xylitol, when it's head-to-head in a study against sugar, completely avoid cavities. When sugar was consumed, cavities formed. When xylitol is consumed, it prevents these cavities. But the other thing that the University of Turku actually showed was that xylitol can help, if a cavity is starting to form, it can help it to repair itself. So Finland has been using this extremely sensible program now since the 1970s. And it has pained me that in England, xylitol is pretty much not known. And in America, it is a little known, but again, most dentists fail to suggest this to pediatric patients who are struggling with decay or to pregnant women. In 2022, an OBGYN researcher at Baylor University in Houston was studying, she actually did a study in Malawi on pregnant women who used 2 pieces of xylitol gum per day. That was all they could actually get over to Malawi. They had hoped for more, for 5 pieces a day, but because it was difficult to get the product to Malawi, they ended up with just 2 pieces a day, 1 after lunch and 1 last thing at night. And this OBGYN doctor was able to show that this xylitol gum reduced the risk of preterm birth in these babies, in these children, in these mothers had less babies born prematurely. Just with that. So there is no reason to avoid xylitol during pregnancy. And I would even encourage you, as I encouraged my daughters who, when they were pregnant, to use my complete mouth care system. Get your mouth healthy, ideally before pregnancy, during pregnancy, and after pregnancy. And keep your any caretakers' mouths healthy as your children are growing. If you have a babysitter that comes to the house, or, you are taking your child to care every day, you either want to ask, if it's a personal babysitter or nanny, they might want to get on board with the whole program themselves. But if you're in a public setting and that's not possible, the other thing a parent can do is actually purchase xylitol crystals, the granules of xylitol, and dissolve them in warm water, small amount, 1/5 of a teaspoon, and dissolve it in a little drop of warm water, and then wipe that on the teeth whenever you can, before daycare, after daycare, if that's possible. You can do it on a sponge, you can do it on a toothbrush, you can give your child a toothbrush to suck. There are certain pacifiers where you can put some xylitol in the pacifier. That's another option. And try to expose your child to a certain amount of xylitol if you feel they are at risk for picking up plaque bacteria from those around them. The plaque bacteria have been shown to come either vertical transmission from parents to children, from caretakers to children, but there is also a horizontal transmission from one child to another. Especially vulnerable are children who have a course of antibiotics, because any antibiotics, perhaps for an ear infection or some other problem, will wipe out all the mouth bacteria and leave the mouth exposed and potentially vulnerable to infection from plaque bacteria. So if your child has strep, sore throat, and has just had a big course of antibiotics, xylitol would be a useful addendum to that. So trying to use xylitol in pregnancy, trying to use my complete mouth care system in pregnancy so that you have a healthy mouth and you can share it with your family, with your children, so that the child's mouth can be cleaned and made healthier by actually consuming xylitol as soon as they are able. And then what we know now is the microbiome, the mixture of bacteria that have developed by the time a child is 4 years old, will become a big percentage of the microbiome of an adult. Now, pediatric dentists have known for years, we say it another way, a child with healthy teeth at 4 is probably going to be an adult with healthy teeth for life. A child with terrible teeth at 4 is probably going to have terrible teeth for life. Now, I'm here to tell you that doesn't have to be. And if your child at 4 has terrible teeth, let's get them on a program. And that program would be xylitol as a key pin, using xylitol multiple times a day, especially last thing at night after cleaning teeth before sleeping. But the other thing to recognize is that new permanent adults' teeth start to erupt at around 5 years old, just around kindergarten, before, during, or around that time. And these first adult teeth are going to come at the back of the baby line of baby teeth. They are the first permanent molars. And often parents are unaware that these new teeth have come into the mouth because no baby teeth are lost. These teeth literally pop in at the back. And if we want this child, because we don't want them to develop fear, we want them to be empowered. Like adults, the more empowered you are, the less fear you're going to have. If you know that you have no plaque, if you know you're using my complete mouth care system that is every day, twice a day, mineralizing your teeth so that any dings and dents are going away, you will feel empowered that you're not going to develop a new cavity. And potentially any little cavities that are there are going to go away. And this is exciting news. And I put every patient that I ever saw on my that wanted to. If you just wanted to have your teeth filled, that's fine. But if you want to go on my complete mouth care system for 3 to 6 months, and then let's look and see what needs correcting, what needs filling, what has helped itself in your own mouth, then that's what I always did. So these new teeth, as they erupt in kindergarten years, are soft. New adult teeth coming in a child's mouth are always soft. And this is the biggest sadness I have. Almost 90% of new erupting adult teeth are harmed within the first year of erupting into the mouth. And this is why dentists believe you need a sealant or a covering over that child's tooth. It's a treatment. Once you put a sealant on a child's tooth, it cannot be removed. It is going to actually percolate into that tooth in the groove and block it up for life. And what I'm recommending is that instead of signing up for that treatment, be aware that your kindergarten child is going to be erupting permanent teeth. and develop the system of rinsing with xylitol, possibly with some dilute sodium fluoride, and that will be a separate video. But I highly recommend doing all that you can with children of kindergarten age to set them up so that their new adult teeth coming in are going to be healthy and strong. And you teach your child how to brush around their teeth, and they will be empowered. They will feel good about their mouth health. And then there will not be this fear. Almost everybody who has dental fear has an experience, a childhood experience. And we owe it to the next generation to give them this opportunity that is on a plate. It is so simple. Xylitol is delicious. Children eat it and love it. You can dissolve these crystals and put it on a baby toothbrush and see a child's face light up. It is delicious. And so I beg you to look into these strategies, not to surround a child by screaming at them, holding them down, flossing their teeth in a tantrum, because it's not necessary. Eliminate plaque. Enjoy the whole process of oral care. Make it a pride, pleasure, delight to have healthy teeth. And this can be done, and this then will change the next generation's attitude, and hopefully no longer the awful thing that was when my parents grew up. People gave newly wedded couples the gift of dentures. It was a wedding gift, a gift so that they could go and have their teeth extracted so that they wouldn't have to mess with their teeth that were just a lifetime of problems. And that is how I grew up, in that environment, to where I am today, where I am begging the world to pay attention to xylitol because it can change everything, especially if you begin right at the start with pregnant women and young children.